Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. How are you today? This is Gil Lederman. We're on Radiosurgery New York Radio Hour, and we're live at the WOR studios taking your calls. We have Ed and Bob in the controls. They're making the radio station the best ever and the program best ever. And just call us. We're at 1-800-321-0710. So if you have questions about cancer or health, 1-800-321-0710. Or if you just want our free booklet DVD, you can call them and leave your name and address. So we have a lot of news today, really a lot of news, and it's all in the last week. So I want to go through this, and the point of this program is really to provide you with information to make your life better, healthier for yourself, your family, your loved ones, how to get the best cancer treatment and lifestyle, how to understand how doctors think so that when you deal with doctors, you're prepared for the battle of the brains. The first topic I want to talk about is bladder cancer treatment, and there's a lot of patients who have been calling me about bladder cancer. It's not one of the biggest cancers as far as incidence, but it sure does change a person's life if you have to go through surgery. And that's the point. For most people, you don't have to go through surgery. There's been data for 40 years showing you can avoid surgery, just like for women who have breast cancer, and we'll talk about it in the program today. There's actually better results if you keep your breast than if you lose your breast. Well, similarly, for bladder cancer, there is treatment where you can keep your bladder even though you have bladder cancer, even with invasive bladder cancer. And usually the treatment involves scraping off the tumor, diagnosing it, and then give combined radiation and some chemotherapy. And the majority of the patients are cancer-free. So there's a new study out this week in an article written by Alice Goodman. She talked about organ preservation is a hallmark of progress in the world of cancer management. Now, isn't that right? We want to keep our body together and our organs together. And for patients with muscle-invasive bladder cancer, bladder sparing or bladder saving approach is well established. Actually, it's not so new, but it's new if you didn't know about it. And it seems like, unfortunately, a lot of patients with bladder cancer didn't know about it, and their doctors don't seem to explain very much. Now, the doctors that diagnose it are urologic surgeons, the same ones who remove the bladder, and there seems to be a little bit of bias towards removing the bladder, even though the data shows great results for saving the bladder. So there's a retrospective analysis that looked at 2 multi-institutional studies, and they found no difference between people who had a complete response or near complete response. So sometimes if the cancer goes away, that's great with radiation, and that happens in many patients. And now there's data showing that if it nearly goes away and you scrape off the rest, you'll do just as well. You don't need to lose your bladder. The authors wrote, these results suggest that it's appropriate to recommend that patients with near complete response to induction treatment be continued on bladder-preserving treatment. And it was 2 radiation oncology groups, RTOG studies 9906 and 0233, that looked at long-term outcomes of patients with invasive bladder cancer that don't need to have their bladders removed. And if you don't have to remove your bladder, then you have a lot better lifestyle. It means you can urinate normally. It means you can carry on your normal life to a very high degree. For men, it means keeping the bladder and the prostate together. For women, the bladder. So it's a better lifestyle, avoiding radical surgery and all the complications of that. And isn't that what we're here for? Now, I just had a call from a woman this week with fallopian tube cancer. So the fallopian tubes are those tubes that carry the egg in the woman from the ovary down to the uterus, where it can get fertilized and grow into a nice little baby. So this woman had an actually fallopian tube cancer. She had other treatment, chemo and radiation, surgery, standard treatment, and it didn't work. The cancer came back. It came back in 2 spots by the aorta. The aorta is the main blood vessel from the heart to the rest of the body. So the cancer traveled to 2 spots. She called us up. What do you think about that kind of situation for your treatment, Dr. Lederman? And I said, wow, it sounds like a perfect case. And we often treat patients who have had prior treatment. The prior treatment didn't work. They have cancer somewhere. It could be the liver or lung or bone or brain or lymph node. In this woman, it was a lymph node. And I told her, yes, we should meet, go over all the details, sit down. As my grandfather would tell his doctor 50 years ago, come in, close the door, sit down, and stay a while. Well, that's what I like to do with you or your loved ones or the people that need it, is to stay a while and understand you and your situation and review the documents and make sure you have copies of the documents, because it seems like so many patients don't even have copies of their own test. They don't even sometimes know exactly what kind of cancer they have. So we're out there to really try to educate you, tell you about all the options, and hopefully get better, newer treatment that is less likely to be deforming or alter your function. And speaking about that, the same topic, saving your body, there's a new article just out this week showing that women who do not have mastectomy do better than women who do have mastectomy. Now, we've always thought that women who have breast cancer have equal results, whether they lose the breast with mastectomy or not. And I'm talking about for most women. I'm not talking about for every woman, because in medicine there's no 100%. There is no 100%. But I'm talking about most women. And an article by Charles Bankhead, who wrote in MedPage this week, saying that breast-conserving surgery, meaning lumpectomy and radiation, led to improved cancer survival in early breast cancer compared to mastectomy. Wow. So for all those people who thought if you do mastectomy it's better, whoops, wrong. And he went on to say, patients treated with breast-conserving lumpectomy had higher 5-year and 10-year survival compared to mastectomy. This was a paper from Dr. Agarwal from the University of Utah in Salt Lake City. They controlled for differences among patients' groups, and they found that if you saved your breast, you have breast cancer, saved the breast, did lumpectomy and radiation, you have a 30% improvement in survival, meaning 30% more people are alive than if you have mastectomy alone. Wow. Isn't that important? So here's another case. We just talked about bladder cancer. Now we're talking about saving the breast. And researchers looked at 132,000 patients and they showed that the 5-year cancer-free survival, if you keep your breast, remove the lump, and keep the breast, is 97%. So it's a very high success rate. Another nail in the coffin for most women who think about mastectomy. Of course, you're the president of the United States of your body. You can choose any treatment you want, but let's look at the data, and let's let the data guide us. Let's let the past guide us very much. We have a caller, John, who's calling from Manhattan. Good morning, John.
Good morning, Dr. Lederman.
How are you today?
Very good, Doc. Excellent.
Great.
Doc, listen, I'm just wondering if the chemotherapy, when you hit the cancer or the tumor, does it get activated, and there's a chance that
when one hits the cancer?
When the chemotherapy or the radiation hits.
We're talking about two different situations.
The tumor.
So for number one, and chemotherapy and radiosurgery are very, very different. You know, they're not comparable really, and sometimes people confuse the two. But chemotherapy are chemicals or medicines that are injected in the body to try to kill cancer cells. And when cancer cells see the chemotherapy, they start mutating. So they start changing to resist that chemo. It's kind of like a cat and mouse situation. And ultimately, either the patient's cured, and there's some cancers that are cured with chemotherapy, and the main ones are lymphomas and testicular cancers. But there's others, like if you have metastatic cancer and you're using chemotherapy to try to slow down the cancer, after a while the cancer mutates and resists the chemo. Now, it's very different than radiosurgery. Radiosurgery, rather than working in just one way, chemotherapy works in one way. Radiosurgery works in billions and billions of different ways, and so the cancer generally can't outsmart the radiosurgery because it works in so many different ways. It can't mutate enough to resist it. And that's why our success rate is about 90% when we hit the cancer for the rest of the life of the patient. So it's a very high success rate compared with chemotherapy for metastatic cancer, where usually the chemo doesn't work after a while.
I see, Doc. So more or less, it deadens the tumor and the cancer. It won't spread.
What do you mean it? Which one is it?
The tumor. Once it gets hit with the treatment of the radio.
Yeah, with radiosurgery. When we give radiosurgery, we do things that are different than chemotherapy. Chemotherapy usually works in one mechanism. It's like if you have one trick. After a while, everyone learns the one trick. If you're a magician or you're a parent or whatever, if you have one trick, you learn that trick and then resist it. With radiosurgery, it works in billions and billions of different ways. So in general, the cancer cannot resist the radiosurgery, number one. Number two, we have something called a radiosurgery frame. So we hold the patient in position. We focus the treatment just on the cancer, not on the healthy tissues. And therefore, instead of standard radiation, which may give 20 or 30 treatments, we only give just a few treatments. So it's more convenient. Each treatment's 15 minutes. We hit the cancer, not the healthy tissue. And by doing it, hitting the cancer with a high dose of radiosurgery, most likely where we aim the beam, we can stop the cancer for the rest of the life of the patient.
Beautiful, beautiful.
We have a booklet about our work, actually. If you call in our office number, which is the 212 Choices number, we'll be happy to send you a booklet and a DVD about our work. And you can call us also if you want to speak or meet about your situation.
Pleasure talking to you, Doc.
All right. God bless you, John, and good luck. I hope that everything turns out well for you and your loved ones.
Thank you, Doc. Thank you very much.
We are going to hear from two new voices talking about radiosurgery.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results, and quality of life. Meet